and welcome to another edition of the Kellum Connect MD.com Minute. We've made a change. You're no longer listening to us in your car. You're looking at us on your iPad, your iPhone, your Google device, whatever type of mobile device you have. The Kellum Connect MD Minute is now a video stream. Dr. Kellum, we are moving up in the world.
I'm excited about that, Gib. I'm just sad that everybody has to see what you actually look
I
like.
know, right? They're like, wow, I didn't realize he was that chubby. You think that's kind of what...
Chubby was not the word I was thinking.
Okay. Just ugly, chubby? What is it?
And both of those.
And they're patients of yours, so they already know that you're follically challenged. So that's not any...
Cerebrally large.
Is that what it is?
Yeah,
okay.
for sure.
You know, each week we talk about different topics in the medical community. Of course, we're out here in FM 3009, 3401 FM 3009, 210-945-2121 if you want to come out, set up an appointment to visit with Dr. Kellum or any of the fabulous providers on a litany of medical issues that you could possibly have in the general practice world. But one of the things you have, Dr. Kellum, really cool, KellumConnectMD.com. And that's an opportunity for folks to go online, see a medical professional online, easy, from the ease of their phone, from their computer. Great service you guys provide.
Absolutely, Gabe. It's been going on a little over a year now, and what we find is that it's been a very easy and successful way for people who are busy to connect for simple things: coughs, colds, runny nose, rashes, strains, sprains, or even questions, quite frankly, that people need. It's easy, it's affordable, it allows access from home or office, saves you the time from running to urgent cares or ERs,
sure.
And it really does provide a very good value for our patients and anybody outside of our patient base who'd like to utilize it.
Now that website is KellumConnectMD.com. If you enter in the coupon code GETWELL, you get $10 off your visit. So basically for the cost of a copay, about $39.95 is what it's going to cost someone to see a medical professional. You don't have to go to the office. You can do it from your home.
Absolutely. For $39.95, it's a great value to answer your questions, for peace of mind, to get some question addressed, get medication prescribed simply to the pharmacy. It's a wonderful value in this day and age of medicine.
The other day, I got my blood work done, had my annual physical, and you said, man, Gabe, you have the body of a 20-year-old. Oh my goodness, you have the physique, and maybe not necessarily the physique, but the physicality, the ability to run like a Kenyan marathon runner. And I was like, great. Some people don't have that. Actually, me, I had cholesterol issues, and you told me about those. And that's one of the topics I want to talk about, is cholesterol and dealing with cholesterol and the different types of cholesterol.
So it's a great question, Gabe, because it's something that really a lot of people struggle with. And just sort of as the foundation of information, cholesterol really comes from two places. It comes from what we eat, absorption, and it comes from what we produce, synthesis. And really, for a lot of us, the things that we eat really can influence and affect our cholesterol. Cholesterol comes in multiple forms. There's a total cholesterol, but what we really focus on is good cholesterol, bad cholesterol. But there's a third component of it called triglycerides that are very important as well. And the things that we can do to make a difference with that really are varied and particularly to the individual based on the blood work that we do. What's really important about that, though, is that when we talk about cardiovascular prevention, so prevention of stroke, prevention of heart disease, that's how we really effective change the long term in people's overall care. And so what we suggest is people getting in here and letting us do what we call an advanced lipid profile, which really breaks down risk issues, cholesterol risk issues, insulin risk issues, heart issues that really are more predictive than anything else that we can certainly make a difference with.
My grandmother, she, bless her heart, lived to be 93 years old. She was the most healthy person I knew. She used to walk every day. She and my grandfather walked every day. They ate right, but her cholesterol was through the roof, nonstop. What's the deal with those types of scenarios?
So those are individuals that are genetically predisposed, and there's a whole class of individuals which we call familial heterozygous hypercholesterolemic. So a fancy word for saying basically your genetics is such that it causes you to produce a lot of cholesterol. And in those individuals, you can eat and do well, and we often promote that they do because it helps a whole array of things in terms of your overall health. But those individuals, unfortunately, struggle with lowering their cholesterol. That particular subset of individuals require medications to bring things down. And that, quite frankly, is statins, which are medicines that have been around for a while now. Statins have a particular difficulty in terms of the overall perception in the population that they aren't necessarily good for them. What we say is they do work and people tolerate them well. But there's a newer class of medicines on the market called immunotherapies, and there's several on the market that really do a wonderful job in bringing values down for that type of individual with very little side effects and very little difficulty. And so there's a wonderful way of trying to make that better. What's really kind of cool, though, and I think is the most important thing for our patients to really understand, is we want to treat before it even gets to the need of statins. And one of the things that we really push hard is the use of omega-3 fatty acids. There's a wonderful product on the market called Visipa that really shows good cardiovascular protection for individuals. And what we find is that when we reduce inflammation in the arteries, way before cholesterol really starts to build up as a plaque, but when we reduce inflammation in the arteries, it really creates a environment of good health that really does keep people from building up plaque, increasing risk for stroke and or heart attack down the line. And that goes to our bigger holistic approach of how we really kind of care for our patients in terms of hormone therapy, omega-3, some of the more natural things that really can make a difference in really limiting need for medicine and limiting risk overall.
And that's the beautiful thing about Kellum Family Medicine, is that you pride yourself on preventative medicine. We don't want you to come in when you're sick. We want to do everything we can to keep you from coming in, and that's maybe getting you on normal vitamin supplements, getting you on normal medications to keep you out. Talk about your preventative medicinal concept here at Kellum Family Medicine.
Well, we do want you to come in when you're sick.
Yes, come in. If you're sick, please come in. Yes,
or
please.
If you need to, on KellumConnectMD.com is a wonderful way of managing that.
Well, you're becoming a really good salesperson. I love it.
It's an important part.
There you go.
The most important part of that is that if we can catch people early, we can teach them about disease prevention in terms of lifestyle, dietary changes, some of the supplements that we use, maximizing or optimizing hormone therapy. What we know long term is that people age healthier, they live happier, they have a better quality of life long term. And for all of us, that's really what it's all about. There's no need to feel sick and be tired and be run down and have risk for issues unless you choose to be that way. And for people who don't, they don't smoke, they try to eat right, they try to exercise, coming in and partnering with us so that we can provide all of the information in terms of where your healthcare stands and the things that we can implement that really do maximize the benefit that you're trying to achieve are really very important long term for individuals. And so that's what we're really about here at Kellum Family Medicine. We want to create an environment of prevention that really allows people to be who they want to be for as long as they want to be in a way that really is optimized in terms of how they feel.
I'm going to put you on the spot here. Now, we didn't talk about this topic, so this is truly a surprise question, but you got great providers, top to bottom. Yourself, Dr. Gonzalez, Art Campsey, Ashley Corshane, but you've got a new provider, nurse practitioner, Tina Molinay. Talk about her a little bit.
Christina Molinay is recent to us. So she was a nurse practitioner student with us that we were blessed enough to teach for the last couple of years, and now has joined us full-time here in May. And she, as with all of them, are wonderful. They're very well versed in the philosophy of Kellum Family Medicine, very knowledgeable in the things that we try to promote in terms of prevention. But they're wonderful diagnosticians, but more importantly, they're people with a heart. They connect with you, they listen to you, they give you the time that you need. And in that, I think, is really what helps us understand how we care for you and your family and all the things that people are dealing with. And so I encourage people, if you can't come in, visit with her. I think they would like her, but certainly would appreciate the thoroughness and empathy of her care.
In addition to nurse practitioner Molinay, you've got all of your providers that participate in KellumConnectMD.com, the sponsor for this wonderful broadcast. Remember, KellumConnectMD.com, acute illnesses. If you just want to get checked, if you have any questions about your health, www.KellumConnectMD.com. Make sure you put in the coupon code GetWell. The coupon code GetWell will get you $10 off of your next KellumConnectMD.com visit. Our first video cast, I sure hope our wonderful assistant. Oh, is I supposed to hit the red button? Is that how you started? I trust her. Michelle is fantastic.
Yeah, well, we promise next time we'll work on makeup. It's a little bit better presentation.
I didn't realize he was that chubby. I'm telling you, there's going to be a million folks out there saying that. Guys, you guys have a great rest of your weekend.
Stay healthy.